We clearly need to reduce the burden of cardiovascular disease because it is so tremendous. We often talk about mortality, but we forget morbidity. So many people suffer from cardiovascular disease, and not just the patients, also their families and the caregivers are affected by cardiovascular disease. The burden is much larger than what the numbers tell us. Well, for the European Society of Cardiology, the priorities clearly are both in prevention and treatment of cardiovascular disease. We issue guidelines based on the latest science. But of course, the reach is much larger. We also need to look at the population level. We need to look at what governments can do. We need to look at what we can see, what you can do for entire populations. And this is where the ESC needs the help of the World Heart Federation. And we're very grateful for the cooperation that we have. The World Heart Summit is so important because it brings people not from many geographies, but also from many backgrounds together, so we can exchange our thoughts and our knowledge about what contributes to heart disease and what we can do to tackle heart disease, because it broadens what we do beyond our reach. Very important for the ESC. Because we're meeting people that we don't get in contact with usually, we're seeing colleagues from all over the world, we're seeing individuals who are interested in reducing heart disease coming from a non-medical background, and these contacts are invaluable. If I had a magic wand to make the world more heart healthy, I think my desire would be to reduce the temptations that the population is faced with, the temptations to an unhealthy life. The food we eat, the lack of physical activity, smoking, reducing the temptations to the population.